started.
Hmm. So today's topic is about wound healing. In case of wound healing, there are two aspects of the wound healing. One is role of nature, and the second aspect is our role as a doctor. The role of nature tells us how a wound heals itself, how a wound heals naturally. That tells about the role of nature. In our roles, we do debridement, that is, removal of the debris, some necrotic material, with the help of either some enzymes, maggot therapy, and with normal saline, that is physical. There are many methods. Second, avoid wound lavage. That is, we clean the wound with 0.1% povidone iodine or 0.05% your Savlon to clear the all debris contaminant. And the next thing is the zinc ointment. So these are only three examples that we normally use, like debridement, removal of necrotic tissues if there is dust, fecal material, soil, we remove with these cleaning agent like diluted 0.1% povidone iodine or Savlon, and we apply zinc ointment. So these steps, these are from the R side. But from the nature side, the role of nature in the healing of the wound itself explains that there are four phases. In different books, you will find some books says three phases, but in the small animal surgery book, the latest edition, it is given there are four phases or four stages. These four phases or four stages, the first is inflammation. First is inflammation. The second is debridement, and the third is repair, and the fourth is maturation. So these are the four phases of the wound healing by on its own in the by the natural ways. So first is the inflammation, debridement, repair, and maturation. In some books, this repair phase is written as proliferative because there are three subphases in this repair, and in those three phases there is proliferation. For example, there may be fibroplasia, means fibroblasts are multiplying, proliferating. Then second is angiogenesis. It means blood vessels, endothelial cells are proliferating. And the next proliferative phase is the your epithelialization. So these phases in the textbook of small animal surgery, they comes under the repair. But if you read another books, this repair word is not given. The heading you will find is proliferative. So both are one and the same thing because in repair phase there is proliferation. Three proliferations are there: fibroblast, fibroplasia, endothelial cell, angiogenesis, and epithelial cell proliferate. Then we call it epithelialization. This maturation phase, in some books, it is divided, it is written there. First, they say wound contraction, and second, they say remodeling. So in wound contraction, that is the contraction with the help of myofibroblast cells, and this is the remodeling. So both in this book, these phases, this wound contraction comes under repair and remodeling phase comes under maturation. But in both the books, in every books, the sequence is same. Either the name are given differently, they are giving repair in that proliferative phase, but the sequence in all the book is similar. So the first phase of the wound healing, first is your inflammatory phase. As the name, it is self-explanatory, means it is related with the inflammation. Let's start with one incision. This is the incision. Suppose you are performing OHG or C-section. You put one incision. After putting the incision, what happens? Your subphase of inflammation occurs. That is hemorrhage. Means bleed. Bleeding occurs. Once you put the incision, or naturally if there is any kind of injury, then from the blood vessels, blood comes out. So first is, let's put one incision, bleeding occurs. The role of this bleeding is to clean out and fill the wound. It cleans out and it fills the wound. What is the meaning of fill the wound is? It means it prevents entry of some foreign body or any kind of dirt or anything. It means the place where there is injury, that is bleeding will be there. The role of that bleeding is to clean out and fill the wound. It will fill to prevent the entry of the foreign bodies, any dirty material from the outside. So this filling of the wound is a way of the body to make a protective covering, to make a protective shield on this open wound. So this bleeding will cover the open wound, it shields the open wound so that from the outside this all is filled with the blood. Now it acts as a shield, acts as a covering so that no microorganism, no foreign body they will enter because this is filled with the blood. Then what will happen? See, after taking incision, there is bleeding and the bleeding will fill the gap, fill the wound, and it is acting as a barrier. Okay. But this bleeding will not continue forever. It means to stop this bleeding, to limit this, what will happen? Vasoconstriction will be there. There will be vasoconstriction, at least for 5 to 10 minutes. There will be vasoconstriction. This vasoconstriction may be mediated by catecholamines, bradykinins, and serotonins. After this vasoconstriction, what will happen? Vasodilation. That is the starting of your real, true inflammatory phase. This vasodilation happens in response to your inflammation mediators, inflammatory mediators like your histamine, So there was incision, bleeding occur. Then to stop the bleeding, what is there? Vasoconstriction. After the vasoconstriction, there will be inflammatory mediators are released that may lead to vasodilation. That is a part of the inflammation. This vasodilation, along with increased vascular permeability, permeability. All these are features of the inflammation. The step we are phase we are dealing is the inflammatory phase. So there is vasodilation, there is increase in vascular permeability. So if blood vessels becomes leaky, permeability increase, it means this is the vessel, it becomes leaky. What leaks out, that are your fibrinogen. What leaks out? Platelets. Then other things, clotting factors. These things leaks out. So in inflammation, all these things leaks out, and there may be formation of the clot. So the part A of the inflammatory phase was starting with the hemorrhage, that is the bleeding. Then to stop the bleeding, vasoconstriction. Then there was vasodilation, increase vascular permeability. Then from the vessels, what comes out? This comes out. But at this place in the wound, there may be formation of these are fibrin, means coagulation start. So the part B of the inflammatory phase is clot formation. Clot formation. So in clot formation, there may be fibrin, platelets laid down, then this fibrin and this is formed. But the important thing about this clot formation is there is formation of provisional extracellular matrix. Provisional extracellular matrix, formation of provisional. This extracellular matrix is formed by your fibrin plus some exudate, transudate of the plasma, plus there are some molecules which are called fibronectin dimer. Fibronectin dimer. All these things, they make here provisional extracellular matrix. At this point of time, there is no collagen deposition. So this is not a true matrix. This is a false matrix. The true extracellular matrix is formed by the collagen fibers. So the second step after bleeding, first was hemorrhage. The second step is clot formation. In this clot formation, what are the steps important? One is the clot itself, and second is the provisional extracellular matrix. In third step, this clot will become dry. Then we will use a term scab. Scab and scar, both are different. Scar is in further sequence phases, I will explain that when there is wound contraction, the contraction of the collagen fiber, they bring the edges towards each other, and there may be formation of scar. But this is scab. Scab is nothing but a when this clot becomes dry. So the other name of scab is dried clot. This clot and this is scab. This scab allows the healing process. It allows the healing process to progress under it. Means under the surface of the scab, if at the suppose this is the wound and this is the scab. So this under the surface of the scab, there is healing process. The healing process will proceed under the surface. It means this scab is acting as a barrier. The scab is acting as a barrier. It protects the healing environment. It resists microorganism entry. So everything, the whole process is ongoing below the surface of the scab. So you can suppose this cap is the scab. So all the process which are healing process, they are progressing under the surface of scab. So this is a covering. It is a barrier. It will not allow microbes to enter. It will not allow the blood to go out. So whatever the procedures, they all are progressing, advancing under the surface of this. So it is advisable that don't pick or remove this scab. Otherwise, the environment of this healing will be infected. So scab is nothing but your dried clot. Next, so the first phase, that is inflammatory phase. There were three. First was hemorrhage, that at the point of injury, bleeding was there. Then clot formed, clot formation was there. When the clot becomes dried, it becomes scab. It becomes scab. The second is the phase of debridement. It means at the place of wound, there is necrotic cells, some dead bacteria, and other debris. These are these are the factors which will delay wound healing. They have negative impact, negative factors for the wound healing. So this process of wound healing is going on its own under natural conditions. So first was the inflammation, means the nature has created one covering, that is the scab. Now under the scab, now there will be debridement, where all necrotic cells, debris, they are removed. So what is the meaning of debridement? Means removal of necrotic and all these. There are some cells which are responsible for this debridement. It means this debridement process, the cells involved, mainly they are neutrophils. And number two, macrophages. We'll write monocyte because they will become macrophage later on. Neutrophils are the first line of defense. These are the cells which comes early. So they will appear 6 hours after injury. 6 hours after injury. These monocytes, they will appear later, 12 hours after injury. So first we'll see the role of the neutrophil, how they kill the bacteria and they remove the debris That after coming here, they appear after 6 hours. Now, this debridement phase duration is 6 to 12 hours, but it may be up to 3 days. So first we'll see the role of the early appearing cells that are neutrophils. Their role is known as phagocytosis. They phagocytize the cells. The very important for neutrophil is oxygen dependent killing of bacteria. It means these neutrophils, for them to work, what is important is the oxygen. What is important is the oxygen. With the help of oxygen, neutrophils generate some free radicals, what we call superoxide radicals, O2 radicals. With the help of these radicals, they kill the bacteria. So the whole procedure of neutrophil killing is oxygen dependent. In neutrophil role, there is one in vitro study. They say if the oxygen is less than if oxygen is less than 40 mm of Hg, then this neutrophil will be unable to kill the bacteria. Unable to kill. It means the importance of oxygen is there. So this is the oxygen dependent killing process of bacteria. If you reduce the oxygen, they are unable to kill. So important thing for neutrophil role is the oxygen dependent killing, generation of superoxide radicals, and they kill the bacteria, remove the debris. The second role of this neutrophil is to stimulate monocyte. These monocyte, they appear at the site of injury after 12 hours. Monocyte, suppose this is the site of injury. This is the site of injury. After 12 hours, they come here. These monocyte, when they come out of the blood vessels, their name changes. Now their name is macrophage. Macrophage. So monocyte becomes macrophage in 24 to 48 hours. They appear at the size of injury in 12 hours, but they become macrophage in 24 to 48 hours. These macrophages, this is the blood vessel. Inside blood vessel, they are monocyte. They come out and they become macrophage. Macrophage. These macrophages, they secrete. What they secrete? Collagenase. Collagenases to remove the debris, because these are the part of debridement. So to remove the debris, some foreign material, so they release collagenase. Second, they secrete growth factors. These growth factors, they will help in angiogenesis also, fibroblast proliferation also. Then they secrete some chemotactic factors to attract further more cells at the site of injury to clear this area. They also secrete MMP. Matrix metalloproteases. The role of these MMP is to degrade provisional extracellular matrix. Because PCM is not made up from the collagen, it is a false matrix that was formed from the fibrin, plasma exudate, and fibronectin molecules. So to degrade this, we need some protease enzyme MMP. And the most important role is their phagocytosis. Phagocytosis. And these macrophages sometimes they become multinucleated giant cell to phagocytize the big debris. So these are the monocytes. They so because of all these reasons, they are known as the major major secretory cells of growth factor. Monocytes are known as major secretory cells of growth factor. So first phase was inflammatory. That was the A point was bleeding, that is hemorrhage. B was clot formation and C was drying of clot scab. Second phase we deal with the debridement. That is nothing but a nature's way to clean that area, remove the debris. In the name itself, debride means remove the debris with the help of early cell, neutrophil, later cell, monocyte. In some books, they write for neutrophil early inflammatory stage because they come early. In some books, they write for monocyte entry late inflammatory stage. So the debridement process, we removed all debris. Now this is the real time to go for repair phase. So in repair phase, this surface which is under the scab, see, scab is there. Here the area is cleaned with the help of these neutrophil, monocyte, macrophages, everything is cleared. After this, what we'll do, we'll deposit collagen fiber. Okay. Then we'll do granulation tissue. This gap is filled with the granulation tissue. Once the gap is filled, then we'll make one layer of epithelialization. At the end, that wound will wound contraction, and after that there will be remodeling. So in this manner, we'll move ahead. So up to this, inflammation is over. We stopped the bleeding. The clot was formed. That clot becomes scab. Scab is there. Under the scab, the process of debridement is going on. Under the scab, the process of repair will be going. But up to this stage, in this phase, which was 0 to 6 hours, and this debridement was 6 to 12 hours, but up to 3 days. So in the books, it is given that inflammation or debridement both form lag phase. The term given is lag phase. Lag phase means there is a lag. Lag in what? There is a lag in gain, in wound strength. Up to this point, in this wound, there is no collagen deposition. So the strength of the wound edges is weak. This cloth was giving little bit strength to the wound edges, but no true strength is gained. So there is a lag in the gain is wound strength. So this is known as lag phase, which is constituted by the inflammatory and debridement phase. And this phase is 3 to 5 days. There is a range because up to 3 days debridement will go. So these two phases they make the lag phase. Lag means there is no strength in the wound edges because no collagen is deposited, only clot was there, and in debridement only clearing debris was there under the scab. So lag phase is constituted by the inflammation and debridement, and this is the duration of 3 to 5 days. Now the real phase. Now the real phase will start. Third, that is the repair phase. According to books, during repair phase, proliferative mechanisms occur. Proliferative mechanisms occur. Some proliferative mechanisms occur, like fibroplasia, second angiogenesis, third epithelialization. So the repair phase, it starts 3 to 5 days after injury. The sub-phase of repair first is collagen synthesis, which is equivalent to fibroplasia. So in collagen synthesis phase, this collagen this is produced by the fibroblast cells. So if we know the stimuli for the fibroblast cell, then we can easily understand this collagen synthesis phase. So first we'll see what are the stimuli. This cell is your fibroblast. First we'll see, first is the macrophage. Macrophage will stimulate the fibroblast for the proliferation. Second, there are some cytokines. They also stimulate this. Because of cytokine stimulation, there may be expression of integrin receptors. These receptors are very important for the migration, or you can say movement. Of the fibroblast. Because of these receptors, they move into the wound. The third stimuli is your transforming growth factor beta. It also stimulates fibroblast. Under the influence of this TGF beta, it will secrete some molecule fibronectin. They also help in the movement of the cell. Number 4, some growth factors like fibroblast growth factor. They also stimulate. Number 5 is the oxygen. 20 mm of mercury plus slight acidity. They also stimulate the fibroblast. So all these factors, oxygen tension, slight acidity that is low pH, they stimulate the fibroblast and fibroblast will proliferate, and after proliferation, what they will secrete? The fibroblast, these fibroblast cells, they will secrete collagen, they will secrete some elastin, and they will secrete proteoglycan. All these molecules, they form the fibrous tissue. They form the fibrous tissue. These collagens initially, their orientation is not regular. They are arranged like this. Means they are arranged like haphazard. Haphazard. So their orientation is not regular, and the more important is the collagen which is deposited, they are immature type. It means they are type 3. At the end, when we'll study remodeling phase, then we'll see that type 3 will become mature into type 1. So when there is collagen synthesis, fibroplasia, these fibroblasts, they produce immature, that is your type 3 collagen. So in the repair phase, the first is the deposition of the collagen. And how much collagen they will deposit? As the collagen deposition increases, then number of fibroblasts will decrease. So deposition of number of fibroblasts will decrease and the collagen synthesis will decrease, and this marks the end of the phase. How the phase is ended? Because collagen deposition stops. How the collagen deposition stops? As the collagen they keep on depositing more and more collagen. As of negative feedback, number of fibroblasts will decrease, rate of synthesis decrease, and it marks the end of the phase. So after collagen synthesis, that is after collagen synthesis phase, the next phase is angiogenesis. Angiogenesis. Formation of new blood vessels. So in this phase, again there is migration, there is proliferation of endothelial cells. Endothelial cells. So for their proliferation, some stimuli is needed. Similar to fibroblasts, some stimuli were needed. Here also some stimuli. The first stimuli is the angiogenesis is there. The angiogenic factors. Angiogenic factors are needed. Like VEGF, vascular endothelial growth factor, and these are secreted by the macrophages. Second, low oxygen. And if there is low oxygen means hypoxia. Because of that, what will happen? More lactic acid. So low oxygen, more acid, and angiogenic factors, these are the stimuli for the proliferation of endothelial cells. So these are the stimuli. So for the endothelial cells, proliferation and migration. So suppose these are the blood vessels which are ruptured. So the endothelial cells, they are coming, they are migrating, and from the existing vessel, these will proliferate and join the two, like this. So this is the formation of new blood vessel, angiogenesis. So new capillary, they are synthesized. What will happen? Now because of this, more oxygen will come to the site of wound healing because of angiogenesis. So in the repair phase itself, the first was collagen synthesis, second was angiogenesis, then the third is granulation tissue, formation of granulation tissue. So granulation tissue is nothing but new capillaries, new capillaries, angiogenesis capillaries plus fibroblast plus fibrous tissue. These three things, they make the granulation tissue. And this granulation tissue is formed at the rate of 0.4 to 1 mm per day. In which wounds it is not formed and which wounds it is formed. So those wounds which heal by primary intention. Primary intention. Suppose these are the two edges which are sutured by the wound. Suppose this is incision wound. And once the surgery is over, we close the incision with the sutures. That is the best example of primary intention. But in this primary intention where the edges are near, so no need to form granulation tissue. So where this granulation tissue will form, it will form in open large wounds. Large, for example, there is lacerated wound. Means the edges are like this. So that process of healing is called secondary intention healing. The meaning of secondary intention healing is these edges are far from each other. So to bring these edges close to each other, we will wait for a time period. We'll wait filling of this defect with granulation tissue. After this gap is filled with the granulation tissue, then simultaneously epithelialization will be there. Now because of filling and epithelial layers coming close to each other, now we can suture. When these edges come near to each other, we can suture this. After this suturing, healing will take place. This is known as secondary intention healing, where first we allow this gap to fill with the bright red color granulation tissue, epithelialization. When these edges come near to each other, we suture. So after suturing, in this way, the healing will be secondary intention healing. So this granulation tissue will be formed in large open wound where edges do not meet. They are far away. But it is not formed in incision wound which is created by us for the purpose of the surgery. No need to form granulation tissue. So in this type of wound, directly epithelialization will occur and it will close the edges. So granulation tissue, if we talk about the granulation tissue, it is formed of new capillaries plus there is fibroblast plus fibrous tissue. Fibrous tissue means collagen, elastin, all this. The role of this granulation tissue. Okay, it is found in a large irregulated boundary wound. The role is to fill the large defect. Fill the defect. Second role is to protect the wound. Protect the wound. It means this granulation tissue will act as a barrier to infection. Because of this barrier, microorganism will not enter into the wound. So it protects from the infection. Third most important role of this granulation tissue is the surface. This is the base, this is the surface on which epithelialization will occur. Epithelialization will occur. In case of wound healing, epithelialization will never occur before granulation tissue. It will always occur after granulation tissue. So first, for example, this is the wound and this is the gap. The gap will be first filled by the granulation tissue, then only the epithelial cell from the margin of this wound, they will migrate and come close towards each other. On the surface, on the platform, epithelialization will occur. So that platform, that surface is given by the granulation tissue. And last is, this granulation tissue acts as a source of myofibroblast. Means these cells will play their role in the wound contraction. So in case of repair, we are done with collagen synthesis. Type 3 collagen was deposited with the help of fibroblasts and they were stimulated by different stimuli. Okay. Second, angiogenesis. There were stimuli, new vessels are formed. Then granulation tissue fill the defect and now it is providing you a good platform, a surface. Now we'll start with epithelialization. Epithelialization means the covering, the natural covering which was lost during the injury. That is your epithelium. So formation of the epithelium. So in this process, again there will be migration, proliferation. Which cells? Epidermal cell, epithelial cell. Epithelial cell will migrate and proliferate. From where they will migrate and proliferate? These are the wound edges. From the edges, they will start migration, proliferate. First they proliferate and they will start migrating towards each other. Because the role of this epithelialization is to form that covering back, to restore the covering. On that platform, that surface, they will move towards each other. At this process, it is oxygen and energy dependent. So these cells, epithelial cells, all they migrate. So I explained with two types of wound. This is irregular margin wound. Suppose this is incision wound. In this case, there was no granulation tissue formation. We close our incision after surgery with the suture. Then what will happen? Epithelialization will happen within 24 to 48 hours. Very important time period. the epithelialization from the margin of the wound, it will start and the cover with the epithelium. So in case of incision wound, no or primary intention healing, no need of granulation tissue directly from the wound margin, epithelial cell migrate and they will make a covering. That will occur in 24 to 48 hours. But in case of large lacerated irregular margin wounds, this process will take little long time. In this case also there is proliferation of the cells like this from the margin and they are moving towards the center. And one more thing about these cells, see, this whole procedure is this whole process is going on below the surface of scab. So not only they will migrate and this will cover make a epithelium, these cells they start dissolving the base of the scab. So these migrating epithelial cells they will secrete some protease enzyme protease enzyme and that will dissolve the scab and then scab will shed. There will be shedding of the scab. So this scab will be base of the scab dissolved because they have covered the epithelial covering. Now wound edges are near. If we do not stop these epithelial cells multiplication proliferation, then they will multiply in excess. For example, if we do not stop the granulation tissue, that will multiply excess over the surface of the wound. That is called proud flesh, and that is more common in the horses. Which part? Limbs. So granulation tissue, if we stop this tissue, then okay. If it overgranulate, then it will come over the surface of the wound. Similar to this, if these collagen fibers, epitheliums, they overproduction is there, then the term used will be keloid. So keloids are nothing but the extra deposition of the collagen or epithelium. So to stop this, epithelial cells they are migrating and they cover the lining. But to stop their over proliferation, there is one mechanism operating. There is one mechanism to stop epithelial cell proliferation. That name is very important. That is called contact inhibition. Contact inhibition. So the surrounding cells, because of contact inhibition, they stop proliferation and epithelialization will be stopped because of the contact inhibition. The last part of the repair is the wound contraction. Wound contraction. It means the wound edges which were far apart, they will come near to each other. That may lead to formation of the scar. And this wound contraction is centripetal towards the center. And this wound contraction is because of which cells? Myofibroblast. Myofibroblast helps in contraction and it is centripetal and it may lead to formation of a scar. When the edges are moving, then what happens to the surrounding skin? edges are moving because of this contraction, the surrounding skin stretches. The surrounding skin will stretch itself. So the result of the wound contraction means, see, these edges are moving centripetally. It is contracting, and these surrounding skin, this area also stretch out. It also stretches. The end result will be, it will become like this. It will become, the wound will become stellate shape, star shape, because of centripetal contraction and stretching of the surrounding, this surrounding. So the wound will take stellate appearance because of centripetal contraction of the edges and stretching of the surrounding skin. Epithelialization stops when contact inhibition operates. When this wound contraction will stop? Obviously, the role of wound contraction is to bring the edges together. When edges meet, then this process will stop. When wound edges meet, contraction will stop. So the first phase where we started was inflammatory. 3 steps I explained: hemorrhage, bleeding, clot formation, and scab formation. Second was debridement, removal of debris by neutrophil and monocyte, that is macrophages. Third phase was repair, the real phase. First was collagen synthesis by fibroblast. Second was angiogenesis. And if you combine these two, then there was a term formation of granulation tissue, and it acts as a surface. On that surface, epithelialization occurs. When the epithelial layer is covered, then wound contraction. Wound contraction may leave scar. So these 3 phases are over. The last phase is the maturation phase. In maturation phase, there will be removal of this scar. In this phase, maturation phase, there will be the collagen type 3 will become mature, type 1. There will be cross-linking of collagen. Why cross-linking? To obtain a good wound strength. And okay. So the last step is the maturation of the wound. So in this maturation, it may start 17 to 20 days after injury, but it may go up to years. It may go up to years. So in this maturation, as I told, type 3 becomes type 1. Orientation of fiber becomes parallel to the skin or wound edges, parallel, cross-linking. So after this remodeling, because of this remodeling, the wound will get 20% of the natural strength which was lost in 3 weeks. then there will be slow increase in the wound strength and 80%. I should write only 80% of the wound of the original will be there. It means after the natural process of healing is over, you will never get 100% original wound strength. There will be only 80% of original. And in this maturation phase, scar becomes, that scar was formed. What happened to the scar becomes pale because the vascular supply of scar decreases. Then collagen of the scar becomes lysed. So lysis of collagen occurs, and slowly this scar will be becoming pale and dissolution of the collagen. So these were the phases were under natural condition: inflammation, debridement, and the real was repair. And the last was maturation, which was nothing but the remodeling phase. This repair phase was divided into collagen, then blood vessel were coming. If you combine both granulation tissue, epithelialization, and wound contraction. Inflammation, hemorrhage, clot, and scab. Debridement by neutrophil macro. So these are the four phases of your wound healing. At the start of the lecture, I explained that wound healing is divided into two parts. One, the role of the nature, and now it is our role. Our role is, first is closure of wound. Closure. When to close or when not to close. So first is primary closure. As we know, the golden period is 6 to 8 hours. So if it is less than 6 hours, we called it contaminated wound. If it is more than 6 to 8, the term used is infected. Infected wound. And this infected wound will contain 10 to the power 5 colony forming unit per gram of the tissue bacteria. So before 6 to 8 hours, we'll do the primary closure. But the closure is not acceptable in case of bite wound. In case of bite. If you suture the bite wound, that rabies bite wounds, they are not allowed to suture before 48 to 72 hours because so this is bite wound. If you apply the suture material, so with the help of this suture material, that virus may further enter into the body cavity. So bite wound or mainly rabid bite wound, they are not allowed to close before 48 to 72 hours. These are the bite wounds. So primary closure means we close the wound if it comes in our golden period, 6 to 8 hours. Then there is one term, secondary closure. Secondary closure of the wound. These wounds are fresh, means they are less than 6 hours, but their boundaries are, they are lacerated. They are lacerated. So we cannot close such large wound because the edges are two apart. The edges are two apart. So what we will do in case of secondary closure, in case of secondary closure where the edges are very far apart, we will wait. We'll wait for granulation tissue to fill the defect and epithelialization will occur. Then we'll apply suture. Once these are filled with the epithelial cells, then we'll apply suture and close it. Then it will be healed by secondary infection healing. But mostly for healings, we apply horizontal matrix. So in this case, this is the note. It's to avoid more tension on the wound edges because horizontal matrix will cause interfere with the blood supply, and at the wound edges blood supply is the most important. So we'll apply stent here to distribute the pressure. Stent we can use the IV set tubes. We cut that tube in some pieces and will apply here, so that instead of applying pressure at one point, it will distribute that force or pressure over large area. So blood supply will not be hindered. So such sutures are called stent horizontal matrix suture. The main purpose of this suture is to provide less tension over the wound edges. So these sutures are nothing but tension relieving sutures. These are tension relieving sutures. Next is wound cleaning. Wound cleaning or wound lavage. To remove the debris, contamination, organic material, pus, like this. To remove the debris, organic debris. To remove the pus, like this. For this, just remember only two. First is your povidone iodine and KMNO4. Both are used at 0.1%. The second is your Savlon. Savlon is used at half of the povidone iodine. Half of this is 0.05%. And the more important name of Savlon is chlorhexidine. Chlorhexidine. So these two are used. And the third, the list is never ending, like normal saline, RL, sometimes tap water if it is clean. So for MCQ purpose, povidone iodine is more important, 0.1%, and chlorhexidine 0.05%. The difference between these two to clean the wound is important. PVP, povidone iodine, 0.1%, and your chlorhexidine 0.05%. The important point is this will become inactive in case of organic matter. It means if there is pus, blood, it will not work. But the good thing about chlorhexidine, it will work in the presence of organic debris, whether it is pus, blood, and effluent. It will work. The second more important about this difference is it has little or no residual activity. Residual activity. But chlorhexidine has residual activity for 2 days. That is also good advantage of the Savlon over the your Vitari. The residual activities for 2 days and working in the organic debris, pus, blood, and And the last is your H2O2. H2O2 has forming action. It will form a forming action. So this, because of this forming action, it will remove the debris. And second, it is having sporicidal activity. It will kill the spore. A wound which is dirty, filled with the soil, and soil is a good source of Clostridia. Clostridia will produce spores, so this H2O2 will kill the spore. So it is sporicidal. But it has no bactericidal activity. It will not kill the bacteria. But if it is a clostridial soil wounded wound, then that will kill the spore. But this H2O2 is cytotoxic if used in more than 10%. It will kill the cell. How it will kill the cell? By releasing some radicals. So it will cause free radical injury, and it is dangerous. High concentration. So these were some topics like how wound healing, phases of wound healing, primary closure, secondary closure, and how to lavage a wound or cleaning, which cleaners are used. There are many more topics, but they are simple like factors affecting some internal factors, external factors like vitamin A, C, E, and zinc also there. So you can read these are simple factors affecting.